Hello, planet Earth. I'm Lilia, and welcome to our weekly Wednesday program, bringing themes on trans health more to the forefront. Today, I'm very honored to welcome two experts from two countries as usual, facial gender analyst Alexandra Hamer of VirtualFFS.co.uk and Dr. Daniel Simon, a facial gender specialist of Facialteam. Thank you both for coming.
Thank you, Lilia.
You're welcome. And
so for our listeners here, sorry, Alex.
Thank you for pronouncing my surname correctly. Almost nobody does that.
I'm always correcting people. It's Hamer, and it's with one M.
That's right.
So, I was saying, to our listeners, please tell us your questions in the comments below. They're all valid queries, and we would love to answer them. So don't be afraid. Write your questions below. So now let's learn a little bit about our guest, Alexandra Hamer. She's the author of a 10-part thesis on facial feminization, and beginning her research in 2002, she is currently one of the only artists in the world to have worked in such detail on the sex characteristics of the human face. And she has created virtual FFS simulations of about 4,000 patients now, 4,000 faces. Welcome again, Alex.
Thank you. I say 4,000. Actually, I don't really know the number. I don't keep an exact tally, but it's somewhere between 3,500 to 4,000, I think.
I'm sure it'll be 4,000 soon. So Dr. Simon and his colleague, Dr. Luis Capitan, began Facialteam in 2010, which is a multidisciplinary surgical team of over 50 professionals dedicated to gender-affirming facial surgery. Welcome, boss.
Hello, Lilia.
Here we are again. So,
yes.
I'd like to start with a little bit of a background with you, Alex. If possible, can you tell us first what exactly is virtual FFS in a nutshell?
In a nutshell, I basically just simulate FFS procedures on people's photographs using Photoshop, standard Photoshop, so that they can sort of get a sense of what's going to happen and what the possibilities are, and also to help prioritize what the procedures are going to be, so on and so forth. So yeah, it's essentially the virtual FFS is just me simulating the pictures, but I also do I do written assessments as well, where I explain in quite a lot of detail all the everything that makes a person's face masculine or feminine and what can be done about it, and trying to sort of help them work out whether it's worth doing a particular procedure or not, and stuff like that. So the service itself is like a kind of a broad analysis of your face with photographic simulations as well.
And I'm sure this is very...
An interesting thing, sorry, Lena, the interesting thing about this is true, is that the virtual FFS should not be confused with the fact that someone takes any kind of software and just tries to make something with the face to make it feminine. As Alexandra said, it's a whole process that comes from first deciding and making an analysis to see what are the procedures that are indicated for the face, and then being able to apply the changes in a realistic manner. Because doing changes to a face is very easy in Photoshop, but it's not so simple in surgery. So artists like Alex, she needs to be working in a way that for her it's so easy to make a chin smaller or a nose smaller, but she needs to be working inside this margin of reality with surgery. And for that, it's so important that she understands so much and she has studied so much real surgery, how it is. And I think this is the process. It's not so easy as saying I can do simulations on the computer. What she does is much more than that.
Yeah, this touches a little bit upon the current problem with things like FaceApp.
Yeah.
If you're seeing patients who are bringing in FaceApp pictures and saying, "Can you do this, please?" But you know, it is very important to understand that FaceApp does, as a fantastic app, but it does things to your face that are simply not surgically possible. The most obvious one being is they make your actual eyeballs bigger, and you can't do that surgically, you know, and it's very feminizing, unfortunately. So yeah, it's important to understand the difference between what a feminine face is like and what is surgically possible, which they're not always the same thing.
Absolutely, the realistic aspect is key here. So Alexandra, could you tell us a little bit about why you decided to create virtualffs.co.uk?
Oh, that was desperate necessity. That was me at the beginning of my transition, thinking, well, this is hopeless, basically. So what the hell can I do? And I thought, I'd heard that there were possibly procedures that could be done to feminize a face. So, you know, I was in a very dark place, just grasping at anything I could do that might give me some hope that I can progress with this and do something about this gender dysphoria problem. So yeah, I started messing around with pictures of my face, but I had a background, a little bit of a background in art and some experience with Photoshop, actually restoring old photographs, and there's quite a big overlap between the two things, strangely. And then I kept doing it, and I thought, oh, I think this could be helpful to some people. I might ask some other people if they would like me to try and do it. And then, you know, it's basically how it started, and it grew from there. And then there's a whole world of research and experience that came out of that. But that's essentially, it started out of necessity and terror.
Yes, and then we got in touch with you, and the relationship began. And can you tell us a little bit about how many hours you've been in the operating theater observing actual facial feminization procedures and the consultations that you help us with as well?
Yeah, so let's see, I met Luis Capitan in 2011 in London. He just invited me down to have a conversation, and which went very well. And I suggested we could perhaps try VirtualFFS live during a consultation, and he thought that was okay. So we tried it, and it worked. And then, what was the second point? You got
yeah, observing in the OR.
Yeah, I've not done a great deal of that. I've done a little bit of watching in the operating theatre, and it's really helpful. It was a fantastic opportunity. I'm very grateful to Danny and Luis for making that happen, because yeah, apart from the fact it's kind of a privilege to see something like that happening. It's quite an extraordinary thing, but it also really helps with the understanding of what's going on underneath, because you have to have this kind of understanding of that. For instance, when you remove brow bossing in a picture, it's not you need a sense of how thick the soft tissues are, for example, and that's very hard to gain from just looking at pictures online, or even like a CT scan where you can kind of see the thickness of the soft tissues. But when you see it viscerally in real life, it really helps you have a feel for it. It's a little bit like if you want to cook a dish, if you want to cook paella, you can read it in a recipe book and do probably something quite good. There's nothing better than actually going to Spain and trying it there, tasting it, you know, and getting a sense of what it really tastes like and feels like in your mouth and stuff. Then when you go back, you really know much more than you can gain from just a recipe book looking at pictures. So yeah, it was hugely helpful to me, but I haven't done a great deal of it, but I have done a little.
And it's interesting that I think that Alex, having the opportunity to watch surgery, she just confirmed some aspects that I know she has, that it's to be conservative, that to be very, very careful about advising surgery to patients, because she has always been very, say, conscious about the seriousness of a surgical procedure. So she understands very well that it's not about giving a lot of procedures and indications to all the patients, because every surgery is a procedure. It's there are risks. it's invasive. So it's not like a menu that you or a hairdresser that you just order a lot of things. When you're choosing the procedures, you have to choose them wisely so that you can choose the least amount possible to achieve the maximal result, because surgery is surgery, and it's something that we all have to take it very seriously.
Yeah, which is one of the main reasons I actually enjoy working with you guys, because of this. It's exactly the same philosophy as I have. You know, surgery is a controlled injury. There is always a cost. Whenever you cut in, there is always a scar. There is always damage, and you know you can't just you know you do have to try and get a balance between these things. And you do see an awful lot of out there who just recommend huge numbers of procedures, many of which aren't actually going to make any practical difference. So yeah.
Yeah, so Dr. Simon, you've been in consultations alongside Alexandra, both physically side by side as well as virtually. As some of our consultations include what we call a live and virtual FFS. Over the course of the years, what is your favorite part about having these consultations with Alexandra in them?
Well, the consultation is my favorite part. I mean, you have two types of consultation in my view nowadays. After all these years, you have simple consultation that is very common, where you talk to a patient, and you have the super consultation where you have someone like Alex by your side. And having Alex by your side is not that she's not there to agree with you. It's a challenge, because it's all the time that I have her. First, she's completely free to speak whatever she wants. She's going to she is presented to the patients, and they understand she's also a facial gender analyst. So she is going to have her opinions. It's not uncommon that we have small disagreements. We're not fighting, but that we are not sure. Maybe I think something, she thinks something else, and it's 100% of the time we get to a common ground, which is better for the patient. So we are adding the possibility of an other opinion. We are adding her, not only her opinion about the treatment, but her input, which will help patients understand FFS, what's going to happen. Alex is a previous patient as well, so she's the one that understands how the process works. And of course, finishing the consultation, normally she's working while we are talking to the patient. So finishing the consultation, after I have explained everything we are going to do, and being able to put that on the screen, and the patient has a realistic view of what could happen to her face, this is amazing. It's amazing, because it's like removing so much stress, anxiety from the patient, of their family, because one of the main concerns patients have, or that the result is not what they expect. They don't understand sometimes what's possible with a forehead surgery. And the other concern is that they can have a surgery like this and they're not going to be completely someone else. And having the simulation is, I think, a good relief. It's just a big confirmation of what's possible.
I think you raise a very good point about the differences. Usually something like where it's a very borderline decision, and perhaps you think, yeah, I think that would be worth doing, and I'm thinking, oh, I'm not completely sure it would be worth doing. It's a kind of it's not a like, oh, this is crazy, you can't possibly do. There's nothing like that happens. It's just this kind of, yeah, on balance, what if it was me, would I probably wouldn't, or you know, so on and so forth. So and it's very important to understand that, because these things are often not black and white. Although facial gender is an objective thing that you can measure, the decisions about what you should feminize on your face can be very blurred and very nuanced, and very much a matter of personal taste and opinion, and even things like budget. And you know, so yeah, it's important to understand that these gray areas exist.
So I'd like to know, after all these years working together, what have you learned from each other? And if there's anything that comes to mind, and it's specifically, Dr. Simon, regarding Alexandra's thesis, if there's something that you it really took on from her concepts.
I can start. When we started FFS in the really beginning, since I have been working with FFS since 2005, 2006. But after meeting Alexandra, our point of view regarding evaluation changed strongly. I think she will tell maybe some things that the way she sees some things also changed, but for us, I think it was more impact. Technically speaking, just to begin with, we changed dramatically the way we see the hairline. We are now probably the team that performs more procedures for the forehead without hairline approach, and being very, very strong on hair transplant. This came completely from her work. We also, I think me personally, I learned a lot from her as a human being regarding what the patient really needs, because sometimes maybe I would be in the beginning more pro giving more treatments, and I learned with her a lot, seeing simulations and hearing her arguments about how you should really choose wisely the procedures that you have to do for each patient. So from 2011, we are now 9 years almost that we collaborate, and I think I have learned a lot. I have learned much more, I must tell you, but these are the two things that come now to my head. Like,
oh, it's the same for me. I mean, I'm simulating surgery, and I have access to actual surgeons. I can discuss anything. If you remember, Danny, we had a meeting about a few months ago in Marbella, where I had a long list of questions, and we spent an afternoon it's loads of little technical details. I just to give you an example, some surgeons, when they make the incision under the chin to do the Adam's apple, they use that same incision to do work on the chin. Now, I'm not a surgeon, so to me, I think, well, that seems logical. That seems like a good idea. You know, there's only one incision, then surely that's a logical thing to do. But Facialteam don't do that, so why don't they do that? So Danny explained to me in great detail exactly why, why it's riskier to go at the chin from underneath, and so on and so forth, and why it's still better. So and also just speaking to Dr. B. Inga, for example, about rhinoplasty, which is a horrendously complicated area. I remember, for example, just asking about lip lifts and why some surgeons had claimed they can do a lip lift with the incision inside the nose, reducing the amount of visible scarring. And why isn't that a good idea? And so he explained to me in great detail. And it's this ability to, any time I have any question, if I receive a complex case through my website, I've got people I can talk to about what the actual possibilities are, and people who really, the actual surgeons, who know this stuff inside and out, and can, resolve an awful lot of myths and mysteries. So, it's hugely important for me. It's completely changed everything, really. So.
And Alex, also to clarify, Alexandra, she's an independent artist, and she works for any patient that sends pictures coming from any surgeon. So it's not that you have to go through Facialteam to have your simulation with Alex. So not only of course, she has our feedback regarding surgery and evolution of techniques, but she's always evaluating and seeing suggestions and indications from other surgeons as well. So yeah, she has a very broad knowledge about FFS in the world.
So I'd like to put a question out there that I hear a lot, and is VirtualFFS an exact representation of actual results? Can you tell us a little bit about that?
It's not, it isn't, and it's not supposed to be. It's not, the way I usually phrase it is to say, it's not a prediction, it's a target. And the purpose of it is to establish what procedures are going to make the most difference to your face. I'll give you an example. We see a lot of patients who assume that their jaw is their biggest problem and that their forehead is probably fine. And so often it's the complete opposite way round. There's one thing saying to a patient that, well, actually, your forehead's the main thing. But when you do a simulation, you can show them why, and then they can see for themselves. And now I've lost track of what I was saying again. What was the question?
You're talking about if VirtualFFS, it's a perfect prediction of what's going to happen.
Oh yeah, yeah. So, and then there's also things like, for example, when I simulate a rhinoplasty. Now, I will simulate a kind of the classic average female nose, and but patients have a lot of thoughts and feelings about their noses. So they can look at that simulation and say, no, 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 I don't like that at all. That's not what I was hoping. And so then you can have a conversation. They'll say, I want it more scooped, or I want to keep a little bit of the hump, and then I can make adjustments. And by that process, we can move towards, you know, the thing that they want. But there's also, it's important to understand that there is an unpredictable element in surgery, because people heal in different ways, you know. So yeah, it couldn't be 100% accurate, but it's a little bit like an architect's drawing, you know, where it enables you to really think about the thing and decide what you want to go where and what's going to make a difference, what's not going to make a difference. So it's all part of the planning process. But yeah, it's not a prediction. This is exactly what you're going to look like. It's just a tool to help you get towards.
It's even sometimes it's interesting because we are doing a consultation, a first appointment, and Alex has done a simulation and shows the patient, and the patient she likes a lot, but she becomes anxious about small things she wants to change, asking her to change immediately, because sometimes patients think that what we are doing now in the simulation is going to be exactly what we're going to do on the face. So it's like, okay, but make that nose a little bit like this, because you're going to apply that mold. And no, when the real role of the simulation, as Alex said, is a guide. It's to see for you, for yourself, if the impact of each of those procedures is good or not. And in many times, because we work with this every day, and we know what is the impact of a forehead surgery, of a nose surgery, but many times patients, they cannot understand, and I completely understand why they cannot understand the impact of a forehead surgery, for example. It's difficult to visualize. We are used with doing, imagine your chin smaller, but how can we imagine your expression more feminine and less bossing and a more round forehead? These are things that it's difficult to visualize. Even if you see the problem, you want to see what's the possible result. And seeing the possible result can help you understand if this is something for you or not. So it's not about a tool to promise surgery or to promise results. It's a tool that, if done realistically, of course, like, for example, like Alexandra does, it's very, very useful.
Absolutely. And I usually tell patients that it's also a good way to help family and friends, the people in their support network, understand that, you know, their loved one isn't going to look like a completely different person. That's a real worry they have, that they're not going to recognize the person they love anymore. And so it's a good way for them to feel like, oh, okay, yes, we see that this is about how it could improve, giving us an idea of how the face will change, not, you know, providing a definitive result. So on Alex, on your website, you have pages that talk about disclaimers and promises in regards to the simulations you do. And you also have a page that's the 12 top tips. So I'd like both of you, if you had to say one tip to patients who are considering facial feminization surgery, what would that be?
You go.
Alexandra?
You know what? I don't know. I don't know if I can narrow it down to one thing. I mean, my philosophy in life generally is question everything, and I do mean everything. So I mean, it's difficult because the top tip really depends on the patient. Because, for example, there are patients out there who really want to know every single detail about the surgery. They want to know everything from beginning to end. They want to know about the surgical techniques. They want to know about the tools. They want to know everything. And for these people, asking questions is very important. So that is kind of the key thing. But there are other patients who don't really want to know anything about that. They've done enough research to know that they trust a particular group of surgeons, and they really just want to be told, you know, what is it I need? And So yeah, I'm afraid I can't narrow it down to one.
It's okay.
That's fine. That's okay. I think that's a good, the way that you summarize it is a good way for people to understand that it's not so easy encapsulated. These are the 12 things you need to know.
Yeah.
And that's it.
It sounds like a good YouTube video, right? Like those 12 things, four
Exactly.
times Zac Efron appear in the big.
So I like
different, yeah.
I like the
But
tip.
yeah, if I have, if I only could give one tip, of course, it would be that you do, if you do your FFS, that you do it for you. So it's something that you don't do for others. That when you do it for yourself, because it's going to round up a circle of quality that is extremely good. I mean, if you do it for yourself, the chance that the results are going to be really good is very high. If you do it for others, we are dependent, of course, on the feedback, on the way someone look at you, on the way the family or friends, their husband or wife. And if you do it for yourself, I believe that the success rate is much higher.
Thank you, Dr. Simon. And for those who are listening to the video, please check Alexandra's website, virtualffs.co.uk, for the pages on the disclaimers, the top tips, and more. And I think we're both on the same page here in that it's really depends on the individual. It's a very personalized thing. Yeah. So that was more of the practical side of things. Now I'd like to put out a couple of technical questions to you. Alexandra, on your site, you have a great frequently asked questions section, which comments on the aggressive versus conservative approaches. There's this debate now out there. What opinions do you both have on this topic?
Well, first of all, it is quite an important topic, yeah, because it is something people bring up a lot. The first thing to understand is that when people talk about aggressive versus conservative surgery, they are actually talking about two different things. One of them is the size of the change. Okay, so for example, if you make a huge change to a chin, somebody will say that's an aggressive change. And if you make a very small change to a chin, somebody will say that's a very conservative change. But of course, what matters is what is the appropriate change for that chin. So if you have a very huge square chin, then a large change may be appropriate for you. But if your chin is small and only has a tiny little bit of squareness, then it's going to be a small change. Now, if you want to use the words conservative and aggressive in that context, then it doesn't necessarily mean that conservative is less feminizing. In theory, both will get you to, say, a 100% feminine chin. But one requires a big change and one requires a small change. So, you know, it's important not to think of aggressive and conservative as in aggressive is good because it's really feminizing and conservative is bad because it's not so feminizing. No, either can be completely feminizing. And the other thing people mean when they say aggressive versus conservative is the number of procedures. So, for example, going to let's imagine they have assessments from two different surgeons. And one surgeon says, well, just forehead and nose, I think is everything you need. And another surgeon says, no, you need hairline, forehead, nose, lip lift, lip filling, cheek implants, chin advancement, jaw, tracheal shave, so on and so forth. Now, you can say one is the aggressive approach and one is the conservative approach. But again, the question then is, what difference are all those extra procedures going to make? And that's, you know, that's what we were talking about earlier. That's a process of evaluation you have to go through, where you look at how much practical difference they'll make in terms of possibility, if that's what you're after. Will people actually notice that change if it's really small? Can you afford that much surgery? And what are the risks? And I don't mean catastrophic risks like dying on the operating table, but I just mean, you know, things like infections or you know, small nagging
numbness.
Yeah,
nerve damage.
Yeah. aggressivity, conservative. I agree with Alexandra 150%. This is not even don't even should be used like this, because as she said, if you have a patient that has already a forehead, for example, that is very feminine but had still a bit amount of excess of bone on the orbits, you being aggressive or conservative is the same, because what you want, your final goal, is to eliminate that feature that is masculine, that is this excess of bone. So what do you need to do? You need to eliminate it completely. If you go there and you don't eliminate completely and you leave still some bone, then it's not that you're being conservative, you're just doing a surgery that's suboptimal. It's not ideal. So I think that it's not about being conservative or aggressive. It's about identifying the anatomical features that needs to change and change them completely. Change them, I mean, eliminate them completely. If you have a masculine marker on the chin, like a square chin, if you want to make that chin completely feminine and eliminate the squareness, you shouldn't go to the surgery and do it smaller but leave still some squareness. Then you are doing a surgery that is, again, suboptimal. If you go there and eliminate the squareness, it's fine. But it's not about, as Alexandra said, a competition of which surgeon can remove more bone. This is what patients don't understand sometimes. I mean, maxillofacial surgeons are surgeons that are also trained in cancer. It means we are prepared to make a resection of a whole jaw. So it's not about who can remove more bone. It's about who can remove the amount of bone that is the exact amount that will remove 100% of the masculinity and still keep enough support for the soft tissues and keep the size of the jaw, for example, in balance with the rest of the face.
Exactly.
So most of the patients or most of you watching have already met someone that had a very aggressive nose surgery, and now the nose is very small. The surgeon is happy because he made a very small nose, but the face is very large. And then the nose is tiny on that face. So is this being aggressive, or is this overdoing procedure that is not taking into account the rest of the face? So this is a debate that I love to talk about, because not because of their other surgeons, but to clarify this idea for patients that sometimes they are choosing their surgeons by looking for the website that has the before and afters that are more dramatic. And this is not what you should look for. It should be dramatic if the pre-op picture is very masculine. But if the pre-op picture is already good, feminine, or mostly feminine, you shouldn't expect a big after, a big difference. Otherwise, what you're having is just an extreme makeover of the face.
Absolutely. I'd like to let our viewers know that this topic has been discussed in other videos of ours. So please check out our playlist on the topics with Dr. Devin Brian O'Coon from Johns Hopkins University, for example, and some other live streams with Dr. Simon, where we address the topic of aggressiveness versus conservatism. And the relationship of natural results and over-feminization. Yeah. So now
I'd like to say,
yes, sorry, Alexandra, go ahead.
I was just going to add a little bit to that. You know, I think I've sometimes seen people say that they think that Facialteam take a particularly conservative approach, and but the reason I was thinking of that is because, Danny, you were talking before and after pictures, and I think it's very interesting because I said to somebody recently who said that to me, I said, the thing about the before and afters on your website is that they're very honest. You know, you're getting, there are so many surgeons who have websites out there where the before is the most brutal, close camera, hard light, makeupless, miserable expression, you know, which is kind of what you want for a pre-op picture. But then the after picture is a picture taken at a party with hair, makeup, big smile, but you know, people don't realize, and it's not their fault, but people don't realize they're being tricked by these pictures. They just see this fantastic, glamorous person at a party and think, oh, I want to look like that, you know, and that's not what the surgery has done. That's so much else going on top of that. So I think the thing of it, because you guys have been very, very particular about very, very honest pictures so that you have the same expression the same camera distance, the same lighting, the same angles, everything the same in the before and after. What you can see on your gallery is exactly what facial feminization can actually do to a face. I mean, the nice informal pictures are there as well, so you can see it in a different context. But people really need to be careful and not assume that glamorous aftershots imply an aggressive technique, and that technique is you know, exactly what you're after.
Yeah.
Just watch out for it.
Good point, Alex.
Totally agree with that. So now we've gone over a couple of technical aspects, so I'd like to go into something a little more theoretical now. Alexandra, how do you think the different gender identities relate to facial feminization nowadays? Because, you know, a lot of things are changing in terms of gender expression and the terms that we use.
Well, I mean, it's an interesting subject and it's a big subject. The gender identity has never changed. There have always been, for example, non-binary people. There have always been people who have a very distinctly female gender identity and distinctly male gender identity. You know, these people have always been with us. We have always been here. But what's happening now is that they're finding their voices and they're expressing their experience, and we are finding names for those experiences. And you know, this is the thing you see with where Facebook, for instance, has lots of gender options, you know, and people love to mock that, but you know, it's a little bit like I suppose it's a little bit like wine. I don't really drink wine, but I know people go into restaurants and they don't usually choose between just red or white. You know, they don't think that wine only comes in red or white. There's all kinds of red wines. There's all kinds of white wines, and there's rosé wines, and there's wines which are blends of different grapes, and there's all, and you know, so you can, like, when people don't know about wine, they just think, well, there's red wine, there's white wine. You have red wine with meat, and you have white wine with fish. Isn't that's all there is to it, really, isn't there? And that's kind of the attitude that the general public often have towards these gender identities. Whereas in fact, when you look into it, it's actually extremely complex. But how does that relate to FFS? Well, the thing is, it all comes down to the individual and what, you know, I always say life is much simpler if you concern yourself with what people need rather than what they are. So it doesn't matter whether you are a cis female, a trans female, or a cis man, or any one of the non-binary genders. Either you need something on your face feminized, or you don't. And that's really all the interaction there is. You know, if facial feminization is simply a process by which you take a facial masculinity and move it towards being a facial femininity, you know. But there can be all kinds of reasons, and some of the reasons are nothing to do with gender identity. I've worked with somebody who was like a drag queen, kind of female impersonator type person, who wanted to make a couple of adjustments because they, you know, to make their act even more convincing. You know, why not? People can do what they like with their faces in the end. So yeah, there are no separate sets of rules for anybody. It's really just a question of what do you need for your face, and that's it.
Yeah, the answer is for me the same. Is what I said before about you have to, if you do it for yourself, it means that it doesn't matter so much the gender expression, but if this is something that bothers you, that is going to make you happier to work with, then it's why this is how FFS can affect that person, right? And Alex has also collaborated with us in many cases of cis women and cis men that wanted to have softening of their facial features, and that was not about gender identities, was just about feeling comfortable with themselves. So you see that FFS has this big role not only in different gender communities.
Absolutely. Thank you for that commentary. It's very interesting for us. And
The wine comparison was perfect.
I love the wine.
Yeah, one of the best ways I have always
wine, cheese, it's
even.
true. Facialteam sees patients from all different gender identities and gender expressions, cisgender people. So as you both say, it depends on the personal objectives. But on this topic, we work a lot with professionals, and oftentimes professionals ask me, so what's the terminology I'm supposed to use? You know, what are the acronyms now, etc. And Alexandra, I always look to you for help on this topic as well. So if you could tell us, what do you think of the new acronyms, TNBI, TGNC, no, trans, binary, intersex?
I don't know all of them. I think the thing is, because people are finding their voice and they are finding new names for things, and different people with the same, let's say the same gender identity essentially, may have different words to express that gender identity. They may have a different name for it. People from different cultures and different countries, or just different social groupings, will have different ways of expressing the same thing. So this is an area that is very much in flux at the moment, and is very much subject to change. So all I can really say is just keep your ear to the ground, see how things are developing, and listen to the people who are expressing those identities to see what they're comfortable with and what they feel expresses it best for them. But I tend to I call myself a trans woman. I haven't changed that for a while. That seems to more or less do it for me. I describe myself as female. I know there are people out there who have an argument with that, and I'm happy to have that argument. But there are also terms like assigned female at birth or assigned male at birth, which I think are particularly useful. So I do encourage the use of those, because those can apply to anybody regardless of identity. If you identify as male, female, or any of the agender, gender fluid, you're still likely to have been assigned a sex at birth. So being trans is essentially when your gender identity does not match the sex you were assigned at birth. So it's quite a useful term. But with all the other words for identities, it's just keep an open mind, just keep listening, and things will settle in time.
Sure.
Perfect. Thank you, Alex, for that. It clears up a lot. And it's so much more complex than we have time to talk about here in this video. So I encourage people, there are some really good guides online by Stonewall, by GLAD, and other organizations that have created glossaries. So I encourage any professionals or people who are beginning to explore their gender identity or gender expression, are looking for the words for their reality. There's a lot written on it out there. So to close the theoretical aspect here that we're talking about, Dr. Simon, would you talk a little bit about are surgeries always a necessary part of gender affirmation?
100% not. Again, surgeries are only necessary if there is a need for the patient to be happier about that feature. So if a patient has a large nose, but she loves that nose, she has no need for surgery. If a patient has, for some reason, not developed any masculine feature, and she comes to us asking for surgery, we will say we are not going to have to do any kind of surgery. So you have these two situations generally: patients that don't need surgery at all. So why would they have to undergo any kind of FFS? And patients that, technically speaking, in a cold evaluation, would need some procedures if you just evaluated the pictures, but that they are completely happy. And I tell you, this is what we see most of the time. It's a mix. We see a patient that has a forehead that is strong, a nose that is strong, a chin and jaw that is strong, and even an example. And then you start to talk with the patient about what is that she believes is going to benefit her in FFS. And many times they'll say, look, I've always thought my nose is a little bit large, but I like so much my androgen aspect about my forehead. I like the way the makeup works on my eyebrows that are a little bit stronger with the bone. And oh, I love my chin and my jaw, which are very defined, like so many actresses. I don't want to have a smaller jaw, for example. So is she wrong? No, it's just her idea of FFS. It's her idea of what she wants for her face. So again, there's no rule. This is why we are talking today with such a specialist like Alexandra, because she's another possible tool to even help we achieve the best possible plan. Because if it would be easy, we would have an app like a face app that would just tell you what you need to do, and don't dare not do anything I'm telling you, because otherwise it doesn't work. And it's not like that. It needs comprehension, it needs support, it needs different types of analysis. And if you can do all this, then you maybe get the best possible plan. But you have to do a lot of things to get this possible plan.
Yeah, there's I always think there's for most of our patients there are two relationships that you have to think about. One is your relationship to the outside world. Okay, so you know, for a lot, perhaps the majority of trans women, the majority of the people I actually work with and that you guys work with, passability is an important thing. You know, they want to be able to blend in to society and not be seen as trans just to be seen as any other woman. And if they have facial features that are preventing them from being able to do that, perhaps they've got a very strong forehead, you know, a very strong chin, then FFS can be a very practical tool to help improve their passability. FFS does not guarantee passability at all, but hopefully it can improve it. And in some cases, it can take you from no passability to 100%, but those may be the exceptional cases, but in most cases it can improve it. So there is the relationship we have with the outside world, and humans are social animals. It matters to us what other people think of us, and it matters how we're perceived by other people. So FFS can be important in that sense. If passability is important to you, it's not important to everybody. But there are people who already pass seamlessly and easily, but who, for instance, have something which is technically masculinity and that they know they wouldn't have had if they hadn't been through a testosterone puberty. Perhaps that little bit of squareness to the chin, perhaps that little bit of brow bossing. Now, it's not going to make any practical difference to their relationship with the rest of the world and society, but it makes a difference to their relationship with their own reflection, that they look in the mirror and they still feel dysphoria over that little thing. It bothers them. So for them, the FFS is very much a personal thing for their own personal need. So those are two different motivations, I suppose you could say, for FFS that can be relevant.
Right, it's an amazing point of view.
Good. Curious, Stutz, and I couldn't have said it better myself. Alexandra, it's always a pleasure to hear you explain things, because it encapsulates perfectly you know what I understand.
Say nice things. I don't know what to do with myself.
I'm not able to explain it myself, but when you say it, it's like,
sounds on the spot.
So to summarize, Alex and Dr. Simon, if you have a brief takeaway message for the people who are viewing our video that maybe are in the beginning of their transition, or maybe along the way already and are considering FFS, what would you like them to know, to take away from this video today?
I think from this video today, important things that we can take, and I would advise patients, is that first, as Alexandra said, there's much more to feminize a face than only surgery. That there's a big process that we need to work with the secondary features of the face, the skin, the hair, the expression. There are more, it's much more than that. And I think that the biggest point from this video is that deciding which procedures you will have on your FFS, it's something that you should take very seriously. Such importance it has that we, the surgeons, we support ourselves so much with this type of tool that is a virtual simulation. And if you can do this with a specialist like Alexandra Hamer, you are not only adding the simulation itself, but you're adding to it her point of view, or the point of view of a facial gender analysis, the point of view that is just an adding point of view to the surgeon's idea. And this, in one hand, it's a good news saying that there are many ways of getting this diagnostic, but on the other hand, it's saying that it's not easy to get a diagnostic, it's not easy to make a plan. So always question everything. Deciding the plan for your face, it's a crucial moment. It's going to be with you for the rest of your life. So don't take it lightly when you're deciding which procedures you will have, and try to base your decisions in science, in different point of views, like the ones we have been discussing today.
Yeah, I would, I'd second that. I suppose out of this particular conversation we've had today, I suppose that the thing I would say to take away is that is that everybody is an individual, and that it's not a, just because you are a trans woman and you're transitioning, or it doesn't mean that you must have FFS. You know, it's not a step that there is no surgical step that you must have in order to be valid. You know, it's just to understand there is an option out there. Some facial features can be feminized, okay? And so you need to ask yourself, is that something that is going to be useful to you in your life? And if it is, you know, the options are out there, but take your time, do it slowly, think carefully. And, you know, it is, as Danny says, it's a big decision. It's a very big decision, because you can't just undo it. You're going to have to live with it. So, you know, be sure, take your time.
Thank you, Alex. That's true. And I'd just like to remind our viewers to visit virtualffs.co.uk, where you can find a wealth of information on facial gender and facial feminization surgery written by Alexandra Hamer, who is a facial gender analyst here with us today. Thank you so much, Alex, for joining us.
You're very welcome. Thank you for having me.
And Dr. Simon, of course, thank you very much as well for your passion and humility, which are exemplary and engaging, as always, with your straightforward explanations.
Thank you, girls. Thank you so much. I have been enjoying these videos a lot. It came from a moment of sadness and crisis from the coronavirus, where we wanted to be able to express our team, our information online, while we were so close to the world. But at the end of the day, as I told you in some videos before, this became a new method that I believe it's so useful to reach our patients around the world with real information, human information. People see that we are here, that we are just normal people, and that we are just trying to improve to make better surgery and improve their lives.
Yes, and I'm very honored to take part in these kinds of videos and the live streams that we're doing, and also to be the first, I think, the first one to interview Alexandra in video.
Wow.
Yeah, probably. I don't like having my picture taken, so I won't be watching this.
I'll let you know not to watch it. So everybody watching, please put your comments, your questions down here, and please put some clapping in here if you like the video, to let us know any other topics that you'd like to hear about. Your input and lobbying are important. So keep talking to us and let us know what you want to hear. And more importantly, if you are an ally, a healthcare professional working with the LGBTQ+ plus community, show your support now, please, and send messages to your legislators, your MPs, tweet the powers that be, and do whatever you can to help charities such as GLAAD in the US or Stonewall in the UK to continue their work so that basic human rights like healthcare access and being are respected. Stay tuned, please, for our other videos and live streams by following our YouTube channel. Just click here, please, and follow us. And you can also keep updated. In the description, we have the links to Alexandra's website, and we also have the links to our Facebook page, and where we have a private group. And also you can click to sign up for our newsletter down here in the description. So thanks again, Dr. Simon, Alexandra,
Thank you.
for joining us. And I would like to say, stay safe, stay healthy, and remember, heart hands, because your healthcare matters and your happiness matters. Thanks again for joining us, everybody.
Thank you, guys.
Okay, ciao.
All right. See you next time.
Bye.
Bye.